Hi, I'm Melissa Cameron, a fertility specialist from Melbourne IVF, and today I'm going to be talking to you about donor sperm. So you need a sperm donor. What are your options? Many people choose to come to a clinic like Melbourne IVF and use one of our donors that we've recruited through our clinic. Other people may have friends or family that they have approached and have agreed to be a donor for them. So what are the advantages of coming through a clinic? If you come through a fertility clinic such as Melbourne IVF to access donor sperm, you can have the reassurance that all of our donors have gone through extensive counselling processes, lots of different medical checks. We do genetic health checks as well. We freeze all of our donors' sperm for 3 months to ensure that we have the safest sperm possible for you and really reduce the risk of you getting any infections from the donation. Some people do have what we call a known donor, so someone they've found themselves who they then can also bring to the clinic, and they can go through the same program as our clinic recruited donors. And again, this gives you the reassurance of knowing that everyone's been through counselling, everyone's needs are being looked after, and everyone understands what their rights and responsibilities are in the donor sperm arrangement. All donors in Victoria have to be registered, and this is so that in the future any child created as a result of the sperm donation can potentially find information or even contact their donor. This happens after the age of 18, although there are provisions for earlier contact should that be something that you or your children wish to pursue. There are many studies that have found it's really important for donor-conceived children to know of their origins right from the beginning, and having access to information about their donor and the possibility of meeting them is important for many donor-conceived children. So what treatment options are there if you wish to use donor sperm? It really boils down to either having an insemination where sperm is put inside the uterus at around the time of ovulation, or going through an IVF process where the donor sperm is used to fertilise eggs and an embryo is later put into the uterus. Your fertility specialist will be able to discuss these options for you, and it will really depend on your own medical and gynecological history as to what the best option is for you. So if you come through Melbourne IVF, what will you find out about your donor? You'll get a lot of general information such as physical appearance, hair colour, eye colour. They also tell us all about their likes and dislikes. We find out extensive information about their medical history and their family genetic history as well. Many donors choose to write a letter to any potential donor-conceived children. Often these letters are really heartfelt and, to be honest, bring me to tears. Our donors come from all walks of life. They're very generous individuals and know how much the creation of a child means to many families. Thanks so much for watching today. If you're after any further information, please click on the links below.